Hi. In my research case study, I did it on bipolar depression, and I read a memoir written by Augustine Burroughs. It was called Running with Scissors. And in that book, Augustine's mother, Deidre, she was a poet, and had bipolar. She had many manic and depressive episodes, which led to her unstable life. Augustine ultimately had a rocky childhood growing up in Massachusetts in the 1970s. His bipolar mother identified way too much with suicidal poets such as Anne Sexton. His father was a professor that drank all the time. Basically, he was an alcoholic. Instead of dealing with his wife issues, he just drank away the days. Um, and then ultimately, they did get a divorce. Deidre started seeing a psychiatrist, and the psychiatrist's name was Dr. Finch. Dr. Finch was far from a healer, nothing short of what we would expect a psychiatrist to be. He was pretty much a lunatic and made Deidre much, much far off worse than she already was. Some symptoms that Deidre experienced in the book: she had deep depression, manic episodes, a lot of very high lows, a lot of highs and a lot of lows in her moods. Complete mood swings can go from being happy to very sad in a matter of minutes. She had excess desire for sex. She involved herself in very risky behavior. She made impulsive decisions. Some symptoms, those symptoms do go along with bipolar, and the people also can feel like, the elevated mood, anger, anxiety, guilt, inability to even feel pleasure, impulsive behavior, difficulty sleeping, and unwanted thoughts are just some symptoms of bipolar. And there's many symptoms of bipolar, from a psychological standpoint, from a physical standpoint, and affects your whole being. To be diagnosed with bipolar is done by a psychiatrist or mental health expert, and is only made by taking careful note of the symptoms, including the severity of the symptoms, the length and frequency of the symptoms. They will ask a lot of questions, about your personal history, about your family history, and if there's anyone in your family that has been diagnosed with bipolar. Sometimes, not always, but sometimes, there is a genetic factor that plays along with bipolar. So if your mom or your dad had bipolar, there's a chance that you could have bipolar just from your genetics. There's treatment for people with bipolar, and it is, a lot of people immediately will start, if they're willing, to start medications to stabilize their mood. And once their mood gets stabilized, then they introduce other things such as counseling, and the counseling can range anywhere from inpatient to outpatient counseling. They also provide education groups and support groups for people, to educate them as much as they can on their disorders, so they can, because it will help them more if they're educated about, what is going on with them. And then the counseling can be from, like I said, from inpatient to outpatient. And then there's also like outpatient intensive therapy, where someone could go like 3 or 4 days a week and spend most of their day in counseling. And another good thing is to control your stress and triggers that can make you go into these manic or depressive episodes. The prognosis in the book for Deidre, Augustine's mom, unfortunately was a very poor prognosis. Her prognosis was so poor because her symptoms were out of control, they were severe and poorly managed, and ultimately Deidre ended up in a psychiatric unit, restrained to a bed. Typically, people diagnosed with bipolar have higher death rates, related to suicide, and heart disease, and overall they have a higher death rate than the general population. Patients who get treatment can experience great improvement in the survival rates, and when the symptoms are controlled, the prognosis can be very good, and individuals can live a good and normal life. Thank you.